again, thank you for joining us this morning. I'm Natalie Rose. I'm the Communications Director for the Arizona Center for Disability Law. If you're unfamiliar with who we are, ACDL is the federally designated protection and advocacy system for the state of Arizona with offices in Tucson and Phoenix, and I'm currently in Tucson. We are also a member of the Arizona Developmental Disabilities Network, who is hosting this online listening session today. Our main goal for today is to hear everyone's concerns and recording them. The COVID-19 situation is rapidly moving, as we all know. It's changing minute by minute, and we know that our developmental disability community here in Arizona is deeply affected, and a lot of our agencies and constituents have been calling, and I'm sure you're all aware of how concerned everyone is. However, today's not the day to answer everyone's questions, but if you know to a challenge, oh, did I get muted? Okay, if you know, sorry about that, I got muted for a second. Excuse technical difficulties. However, if you know the answer to a challenge someone is facing, please type it in the chat box or raise your hand, which you'll see on the right. We really want to make sure everyone's voice is heard. So if you have trouble asking a question, we have a question hotline. And that number is 480-356-5195. It's also on the side. Again, 480-356-5195. You also may send an email to my inbox, nlunarose@azdisabilitylaw.org. Again, that's nlunarose, all one word, at azdisabilitylaw.org. Also, we'll put it up in the chat box, and you can also simply post in the chat box as well. Again, we're happy to have several state lawmakers with us today and some staffers from our congressional delegation. Thank you for joining us, and hopefully our mayor's offices as well. You'll have a chance to hear from a few of our policymakers at the end of the call. Thank you for being here. There are a few housekeeping items that my colleague John McDermott will explain the format of today's meeting and how you can participate. And again, thank you for joining us on this very important call.
Good morning again. I'm going to take the opportunity to read out the guidelines for today. This is general housekeeping for this Zoom online session. I've also copy pasted them into the chat area. So starting with number one, please assume good faith from your colleagues. We're all here to learn together. Number two, please use the chat or raise hand function if you're joining via computer and wish to share. You'll be called on to share verbally. If you're on the phone, please be patient as we will try to have time for folks to share directly from their phones. Number three, please recognize and respect others' feelings, background, and cultural differences. Number four, not all questions will be answered during this meeting. This is an ongoing situation. There'll be more meetings and more time for questions. Number five, be judicious and efficient with shared information and experiences. If you are speaking, try to limit yourself to 30 seconds or less. It can be just as courageous to listen as it is to share. If you're not speaking, please keep yourself muted. And lastly, number six, if you are speaking, please speak slowly as there is a captioner working diligently. Lastly, I'm going to put an email address if individuals are not able to access the chat or able to speak, please send your emails to ihd@nau.edu. I'll be monitoring that email during this online session. Thank you very much, and I'm going to pass this off. Thanks.
Good morning, everyone. This is Sarah Roof. I serve as the Community Relations Specialist for the Arizona Developmental Disabilities Planning Council. We're also a member of the Arizona Developmental Disability Network. So just like John explained, we are going to open up this time, this portion of the call for questions, concerns, even stories you'd like to share. And to kick things off, I'd like you to think about what is your number one biggest challenge you're facing right now. You could type it in the chat box, raise your hand, click the raise hand button if you'd like to speak. John and Nick, our team behind the scenes, will help facilitate this. What is your number one biggest challenge you're facing right now during this COVID-19 crisis? The list might be long, but what rises to the top for you, your business, the community you're representing, your family, your school? What's the number one thing you're facing? We'll give it a few moments as the number of responses grows here. Finding supplies is one that a lot of people are mentioning in the chat box. Finding PPE for staff. Someone at a school saying students not being able to utilize online technology. If you're looking for the raise hand icon, by the way, you'll find it if you click on the participants button at the bottom of your screen. It will open up a sidebar, and then you'll see a row of icons. There's a little blue hand, and you can click raise hand if you're on the computer. Student involvement. Yeah, that's a huge challenge, absolutely. Keeping people connected with their support circles, someone writes. Here's one about housing. Adult developmental home providers are being asked to work extra hours with all the day treatment program closures, but the money to come with that for compensation isn't flowing. Yeah, we've heard that for sure. Rural students in rural communities not having access to their regular therapies. We're getting a lot of great responses here. John and Nick, is there anybody on the phone that would like to share what the biggest challenge they're facing is right now?
I have a raised hand, so I'm going to unmute Socorro.
Hi, good morning, everybody. One of my concerns currently is that I work in the medical field. Unfortunately, because supplies for medical PPE is very low, and I'm not being provided with it at work. And I work very close with patients. So I'm afraid that I'm going to bring this home to my family, especially to my son who's got several medical conditions. His day program is closed as well. So I'm not having that support where I have anybody to take care of him. And I'm having to stay home with them. So what other resources are out there to try to help me with this situation?
Socorro, what part of the state are you currently in?
I work in the radiology department. So I work x-rays, bone densities. My main job right now is mammography. We have closed down to regular screenings, but we're only doing the diagnostics. I'm only a couple inches away from the patients. Unfortunately, we don't have enough PPE for us or for the patients as well. So, as we know, it might take up to 14 days for anybody to display any type of symptoms of the COVID-19. So that's one of the concerns. Right now, I'm staying home for this week because my son has been sick, but I do need to return back to work as everybody else around here has bills to pay and depends on income to survive.
Well, thank you for sharing. That definitely sounds like a big challenge. Are you in the Phoenix metro area or in a rural part of the state?
I live in Tucson.
Okay. Okay, thank you so much for sharing. John and Nick, do we have someone else on the phone who'd like to share?
Not seeing any raised hands at the moment. Oh, we do. We have a Cathy Sweeney. I'm going to unmute you.
Hello, everybody. I just figured out the raise hand, thanks to my husband. I hope everyone's staying well. I guess my most pressing question, I have a couple. For those parents that have very medically fragile adult children that have either lived in an IDLA, which individualized living arrangement, that we've brought home because of their medical challenges. Is there a way to streamline the process for us to be paid providers when we can no longer work?
That's a great question. I know that if one of the resources we wanted to provide today, although we don't have answers to every question, I know we have a lot of different kinds of people on the phone. And if you work at, you know, the DDD housing unit or a housing provider and you have the answer to this, I've heard some things, but I don't feel authoritative enough to say it's, you know, concrete yet. Feel free to type in the chat box or unmute yourself on the phone if you have an answer to Cathy's questions, or if you've heard about anything regarding family members getting paid to provide services in lieu of programs closing down, whether housing or others. Thank you, Cathy. That's a really good insight. Thank you for sharing.
I know it's a struggle for quite a few families here.
And which part of the state are you in right now?
Tucson, Arizona.
Tucson as well. All right. Southern Arizona representing today. Thank you so much for sharing.
It looks like Jordan Peterson has his hand raised. So I'm going to go ahead and unmute you, Jordan.
Can everybody hear me okay?
Yes.
So just to answer your question, my name is Jordan. I work with Aurora Behavioral Health in the Phoenix area. I've actually just been doing a lot of reach out to respite and habilitation providers. And I know that a lot of them have told me that some of the fastest ways that they're getting services to families right now is by actually having a family member provide those services in home. And so if there's a lot of issues going on with not being able to get, you know, community providers that maybe you've been working with that are not related to family, going out to homes and that kind of thing. What I'll do is I'll look and see if I can find which organizations those were, but they basically said that the best way to fast track services is to actually use family members. So I'll see if they're doing any kind of protocols right now to see if they can get, you know, services in place just provided by family.
That'd be great.
Absolutely. I'll see what I can find for you. Okay.
Thank you.
Absolutely.
Awesome. Thanks for sharing, Jordan. And if you two want to connect later, I know Jordan, I can share his information, his work email with you, Cathy, so not a problem. Nick, do we have anybody else with their hand raised?
I see Socorro's hand is raised again. So I'm wondering, do you have something to add? Socorro, I'm going to unmute you.
Hi, regarding Cathy's question about, you know, streamlining certification for the parents of adult children. My son is an adult child. He still lives at home, but he does attend the day programs during the day. I did talk to my DDD case manager, and we discussed that. So right now it's been elevated as far as I know, to try to get the parents through this fast track to get us certified, so that at least if we have to stay home like I am doing now, we can at least do a temporary solution where we can get paid for providing those services. And once everything goes, you know, quote unquote, back to normal, then we can continue on, and then our children can go back to their daily activities. I am certified in CPR first aid. I have medical background on me, so that's on my side. But I know that a lot of other parents out there don't have that. So I'm still kind of, you know, wondering what's going to happen if, you know, if there's going to be a more streamlined, or if there's going to be some exceptions made for parents as myself and Cathy out there.
Thank you, Sakura.
I have a request about how to raise your hand if you're joining on your computer. I'm going to post a link to some instructions online, but as Sarah described, you're going to want to click the participants button on the Zoom. And then when that pops up, there should be an option at the bottom of the participant list, one of those buttons that says raise hand. Right, you can only raise your hand if you're joining from the computer, and we are going to give a chance for some people on the phone to join as well. But I just want to give folks one more chance to raise their hand here before we maybe switch to see if some people on the phone want to share. Okay, I see Kin Counts. I'm going to go ahead and unmute you. Thank you for raising your hand.
There's a babysitter making sure he's safe and making sure he's having fun.
Oh, looks like you went away, Kim. Okay, Robin Callahan, I'm going to unmute you.
Hi, I just wanted to share for Socorro and also for Cathy that, you might want to talk to the day program providers. Aries has closed their day programs, obviously, for the safety of the people that we support as well as our staff. But we have been offering community supports to those parents who maybe are in need of them. We're, instructing the parents to contact, provide the DDD case manager to see if there's a possibility that services could be, added for their children. And we're doing our best to provide those supports if at all possible. So you might want to just, talk to your day program provider and see if maybe that's something that they're offering to the parents of the people who are attending their day programs. So just a little tidbit of knowledge, I guess, or a tip.
Thank you, Robin. Can I jump in? Is it okay? Some of us don't have kids in day programs. My daughter works at the university, which is closed down here, and we're in total isolation. Her nurse can't even come into our home because of her medical needs. So we can't have staff, and she needs 24/7 care. She's on a pump that has to be checked every 2 hours through the night. It's pretty intense. And so we're trying to figure it out so we're not exhausted, after 2 or 3 months of doing this. So I appreciate the suggestion, and I think that will work for some families. But like I said, she doesn't go to a day program, and because we cannot have anyone in our home because she's so medically involved, we're trying to think outside the, look at some other ideas here. But thank you, Robin.
Thank you, everybody, for
help much.
jumping in on this. Nick, do we have anybody else on the phone?
Yeah, it looks like Ken Counts is back with their hand raised. I'm going to unmute you again, Ken. Please try. Ken, can you hear us?
I can hear you, but I couldn't. Can you hear me?
We can hear you now. Go ahead.
Oh,
Thank
okay.
you.
Yes. So with regards to having parents to pay, I was thinking if we could have to help relieve the parents who has no help at home to take care of their kids at this point of time, which many of you have mentioned early on, if we could just have being paid for maybe 8 hours, instead of, I know some of us have hours like 30 hours a day. Well, we don't get that. Let's say maybe even paid for 8 hours just to relieve us on a lot of things, because some of us don't have help at all. Just like myself, one thing we want to, have social distancing. We don't want to have somebody come to our house as much as we can. It's very taxing and very stressful with all the COVID-19 going on for us parents at home. So I was like, little reliefs like that. Like, again, we can cap it. Like, okay, we can pay, parents
Seems like Kin has dropped off on the list.
We have a hand raised from Al Nieto. Al, if you're joining by phone and computer, you might need to unmute your phone directly.
FYI, if you're joining by phone and you need to unmute, you need to press *6 and that will remute you as well.
Hello, can you hear me?
We can. Hello.
Hi, I just wanted to say that with the division, that support coordinators are calling all family members as well as day programs. And what we are trying to do is determine if additional services are needed at the home by parents, as those that are on the line have said. What additional services might they need? If you have not received a call as yet, I would suggest calling the support coordinator. And on the second part of that, with respect to paying family members, that is something the division is looking into, but we don't have a determination as yet. We're trying to expedite that as quickly as possible.
If there's anyone else who joined by phone who wants to talk, I think we're going to try and take that. You can't use the raise hand function if you're only joining by phone. So I will ask if anyone by phone wants to share, to try to unmute themselves using the method that Barb suggested. If more than one person talks at once, I'll jump in and create a queue. I'm seeing a 4925 phone number that unmuted themselves. Do you want to share?
Hi, this is Cindy Mathers. I live in Apache Junction. I want to extend my heartfelt blessings during this time and remind people, if they can, to take a moment to kind of breathe in some good and breathe out the bad, and take a moment to focus on that during the course of these troubled times. And maybe it might help to do some extra learning. What I've been canning for a while, like Grandma did, and I'm finding, those things to be as fun as always. And I know not everybody does that, but I think it's important to find take time to reflect and do those things with the busy world the way it is. I don't even have the words. There's so many mixed messages out there that I just try to listen to some music and maintain calm and prayer, and hope that we have strong communities to hold together to help in these trying times. So I want to offer all of you my blessings.
Thank you very much for that message. I really appreciate that. We have someone with a computer who has raised their hand as well. Aron Nathan, I believe, shared before the meeting. Please unmute yourself and share.
Hi, I'm in Tucson, Arizona. I'm part of a vocational CTP vocational rehabilitation program with students with intellectual disabilities, adults. So far, but on the day-to-day information of how this is working, the only short-term solutions seem to be, as proven by lots of other cities and countries in the world practicing shelter-in-place practices. Not everybody is able to do that, and I understand. But just for even yourselves in the community, as much as we can do online things like this and informationals to help each other and not have person-to-person contact, because a lot of your issues are long-term. They're not going to go away when this pandemic goes away, but it goes away faster when we have as little contact. And even I was reading last night how the potential for hospitals getting so much overflow if it doesn't calm down nationally, to think about things even as simple as if you have flu symptoms, if they're not critical, they specifically said pneumonia type symptoms, try to do as much self-care at home until it becomes a critical issue, because every time, even if they can test, they have to use PPE that they do have each time they test. So that's one wasted if you end up testing negative, and there's a 30% fail rate, false positive or false negative for the tests in place. So simply social distancing has not so far been enough in most cases. So I just want you guys to think about each other that way, because there is going to be another side of this. And the more short-term inconvenience we take on ourselves, the less long-term loss we're going to have.
Thank you very much. Jessica Obregon has their hand raised.
Hi, my name is Jessica. I am a supervisor with the Division of Developmental Disabilities. And I kind of just wanted to chime in a little bit in regards to some of the conversations going on with services from us. So what we're trying to encourage is more staying at home. So I've gotten a few requests from day programs lately asking to enhance services at the day programs and getting one-to-ones for our members. And my response back to those agencies has been to encourage social distancing. A one-to-one is kind of the opposite of social distancing. So what we would like to do, and what I'm starting to do in my unit, is so if they can provide a one-to-one in the day program, why don't we use that provider in the home? And why don't we keep that member home, and we can put those hours that would be used at the day program into a service in the home. And that allows the person to be in a safe environment where they get those services. And we're not continuing to expose more and more people. So I encourage you as family members to kind of push back on that idea if you get that from an agency, and kind of reach out and say, why don't we do this? I am approving hours as the requests come in. And so if a family has to keep working and the person can't go to their program, we can get a provider in that home. If we need to do a vendor call, we're going to try to provide that service as often as we can. So we are trying, and we are trying to reach out to all of our families. It just takes a little bit of time to talk about offering those services in home as the programs start to close their doors. So thank you very much.
Thank you. I see a hand raised from Gail Quackenbush, and then after that, it looks like a phone number ending 4925. Gail, I'm going to unmute you now. Gail, are you there? Okay, I'm having some trouble hearing you, Gail. I don't know if you need to check your audio sessions, but if...
Gail responded in the chat that she is not on the phone, so she doesn't have the ability to speak.
Thank you very much. Is the phone number 4925 wanting to share?
Yes, my name is Autumn Sneed. I am a nurse practitioner at CRS, which is Children's Rehabilitative Services. I just wanted to, I guess, share some encouraging news. The staff, I work in the Phoenix location, but the administration has been working almost around the clock to be able to allow a temporary ability to do phone visits, which usually with access is not allowed. And so that has been encouraging just to see, because starting on this last Monday, we started doing some the visits that can be done by phone, started doing that so that the children and young adults that we work with that have continuing needs, that we can continue to have that contact with them.
Thank you very much, Autumn. Mike Homko has his hand raised. Mike?
Yeah, can everybody hear me?
Yes, we can hear you.
Just I've got several questions, but I'll ask one and then let some other people ask questions and then keep going. Regarding the personal protective equipment and oh crap, I just lost it. Hold on. The personal protective equipment. And I heard some support coordinators are listening in. What's the guidance for us agencies, those that are providing HCBS services to members in the home, and those for us that are still open as day programs or employment services, if a member tests positive or tests positive or seriously becomes ill?
That's a great question, Mike. People feel free to, if you have any guidance, answer in the chat box. I do not have an answer for that right now, but it's a very valid question. So, like I said, we are collecting, we're typing furious notes, and hopefully we'll get an answer very soon for everybody.
Well, just a note, I heard some other support coordinators are on. I'm wondering if, since it's a community call, maybe they can provide some guidance because maybe they've received directives from their supervisors.
I see Carissa Gutierrez has her hand raised. Their hand raised. I'm going to unmute you now.
Hi guys, I am Carissa. I work with the Dentist for Special Needs in Phoenix. And I just wanted to give you guys a quick shout that we are seeing emergency and essential needs patients right now. Still, while we want to try to offload any patients going to the emergency room for dental needs to allow them to have more access to care for people that are coming in need of medical care. So if anybody needs any information on dental needs, you guys, I can post our information in the chat. I just wanted to get that word out to everybody that we are still open and allowing people to come in. We do one-on-one appointments already. So there isn't a lot of contact with anybody but our office staff. And of course, we're in full PPE the entire time that they're there and full sanitization as they leave. So I'll post that information in the chat. And then if you guys have people that need dentistry and it's emergency or essential in terms of they have pain or any sort of swelling or they need something taken care of right now, they're welcome to come and see us.
Thank you. I see a phone number 4925 has unmuted yourself. I'm going to give you a chance to speak. And then it looks like after that, Linda Ramir and Rick Hargrove in that order.
Are you talking to me?
Okay. Hi. No, I'm the first up is a phone number ending 4925.
Okay.
You, I don't know.
That's me. Excuse me. This is Cindy Mathers again. The other day, I wrote some thoughts down. It's not real long, if you would allow me to share. I think it might inspire some people through these difficult times. Would you mind me reading this for you?
We have a fair number of people on the call that are looking to share. So because you've already shared a bit, we would welcome if you had something short to add, but I don't think we can really have time for anything long.
It's really short. It's not that long.
Go ahead.
People don't have that kind of attention span, quite frankly. Okay. I just wrote on a media page I'm on, sometimes we need to change our thoughts on what we thought we knew, for things can look quite different from another point of view. And before we try to change someone or tell them what to do, remember that the only one you can change is you. I need to be gentle, patient, and kind, allowing for faults, especially my own. And when I have learned how to do this for me, then I will know how to do it best for you. When life all around us seems filled with cares and stress, there's a place of calmness where we can go to rest. Turn within to the quiet, for in its stillness flows the source of all being and the peace our heart can know. Sometimes we need to give ourselves the biggest hug we can. And there isn't always someone near who truly understands. And there is no need to worry if we seem to be alone when we have learned to love ourselves. Everywhere is home.
Thank you very much. Next up, we'll have Linda Ramir if she wants to share, and then Rick Hargrove, and then Howard Zlamal. Apologies, you're third up here.
Hi, this is Linda Ramler, actually. It's an L, not an I.
I apologize.
That's okay. We're kind of spying on you because this went out through, I think, the DD network nationally, and we found out about it and we wanted to see what you guys were doing, possibly to replicate it in Connecticut. I think what you're doing by way of having open-ended questions and trying to answer and reassure people is great. What I also posted in the chat room was our website, because we've been spending all of our time so far looking up resources. We are the National Early Childhood Center for Personnel Development, and have a number of resources for that, as well as others, for example, for self-advocates through People First, because we coordinate that, and some other resources that people might find helpful. And it's at the yukonusaid.org/COVID-19/website. So that's all I wanted to say. I wanted to let people know it's there if they wanted it. Thank you.
Thanks very much, Linda. It's nice to have people joining from all over the country. Rick Hargrove?
Hi, everybody. I just wanted to create one distinction, and that is that oftentimes, especially given the turnover in support coordination, the people that know our folks the best are either providers or families. And when we're designing suitable replacements for DTA for our guys, sometimes you know, what works for one member won't work for another. And so sometimes a one-on-one in a public setting for somebody who will not sit still is a better idea relative to social distancing and staying one-on-one with the group home. So anyway, I just wanted to sort of put it out there as a distinction that, you know, we've served some of these people for 20 years, and we know best what works for them and what doesn't work for them. And so in this time when we're trying to do some sort of substitute services, I would just invite DD and all of us to think about what works and what doesn't work. Because the last thing we want to do is to have our folks have adverse things occur during this time. It's hard enough with just the disease itself. So anyway, that's all I wanted to say. Thank you, everybody.
Thank you very much, Rick. We're going to have Howard share, and then I see Cathy's hand raised. So Cathy after Howard.
Well, one thing that I personally, I'm Howard Zlamal from Tucson, Arizona. I'm a special ed teacher, and right now we just had a meeting a few minutes ago, how to reach our students. And they're students with significant needs. So we were talking about an online model, though it's not always feasible. So right now we're kind of going with the balance. Do we do the online model or do we do homebound, which is a little riskier, yet the quality of instruction with homebound is much better. How do we weigh that? Also, I mean, we do see a lot of concerns here in Arizona, very few hospital beds compared to the rest of the state. Also, food supplies are dwindling and shipments are going down instead of up. I don't know what's going on or what can be done to maybe to get manufacturers to make more of the things instead of less, but I don't want to be too critical. What I really would offer, I would try to offer, because I do present on emergency preparedness for people with disabilities. And the thing I would offer, and some things, one thing that I teach how to do. Let me adjust the screen here because I'd like to show you something that I made. I mean, I don't know if this has any assistance, but it just shows that if there was something I'd be willing to make, even if it's learning how to make medical masks, I would do it. But this is a miniature barbecue grill. I went on YouTube and found a way how to make from a soda can miniature barbecue grill. Oh, here's the cover to it. So I even tried grilling a hot dog and it came out really well, and the grill is just made out of wire. I have been teaching about things to do, like if there's a mandatory evacuation or something like that, and or even if you have just kind of things like that. So if there was something I could do to come up, use some of these little inventions to help with this coronavirus, oh dear God, I would do it. What do you think, guys?
Thanks for sharing, Howard. Makes me want to have a hot dog seeing that. Cathy?
I spoke on the phone last night with another mother that could not be a part of this today. And I'm wondering if Arizona's Center for Disability Law, or DDD, has any other families in this with this same challenge. Her son is in the hospital, and right now they're allowing no parents. She had to leave him alone. And he's nonverbal and terrified. His father passed this year. And it terrifies me for some of us other parents that could be in this situation. And I hope that there is not a precedent set in hospitals, because I heard that they're letting parents for young children be at their child's bedside. And I think there should be some sort of vetting or waiver or something for parents that have adult children that land in the hospital. And I know I called Ron Barber, and he's helping to look into it, but it's like, to me, this could be huge for family members, because when I think about possibly being one of those parents, I mean, I'll probably get arrested because I won't leave the hospital because my daughter can't speak for herself. And I think, I know there's rules and laws and we need to keep as many people safe as possible, but leaving our adult children who can't communicate and do not understand what's going on alone, if they're very sick, does not feel okay to me. So I hope, I don't know if Arizona Center or DDD yet has gotten calls from other family members, but this mom was beside herself because she had not seen her son for 5 days. His hospital phone was broken, and it just broke my heart to hear that that is happening. Because as parents of children with intellectual disabilities, if that happens to us, we need to be able to be that advocate and be their voice at their bedside.
Thank you very much, Cathy, for that and your emotional rawness and realness that came through. I can see people in the chat are responding as well, so thank you. I want to give Cheri a chance to speak next, who's had their hand up for a little while. And then there's someone with their phone number 8881. That might be Cheri too. And then I see Aron is raising his hand again, so we're going to get you in as soon as we give a chance to people who haven't shared yet. Thank you. Cheri, I'm going to unmute you right now.
Okay, hello everyone, and I know this is going to be quick, but I am from Southwest Fair Housing Council out of Tucson. We serve all Arizona communities in fair housing. There was a guidance that just was released in January of 2020 that addressed the issues that we have as far as people with disabilities and their animals. That 60% of our complaints based on housing discrimination comes from people with disabilities. So one way, what we do is travel the state, and some of you I've met and we've done classes, but we travel the state, offer it for free since we're grant funded. And in the response to this pandemic, what I'm doing is going online. The classes are going to be small, they're free for the whole month of April, which is Fair Housing Month. It is set up on Wednesday mornings, Thursday afternoons. I put in the website where you can go and register and get details. We're going to try this. The first hour and a half is just going to be on, or the session is just going to be on disabilities in this new HUD memo. So if, for those of you who have some time and want to get more education, it's free. Again, we're offering it. And the next one will be probably something about reentry folks, what the HUD guidance is about that. And we're trying to seek what kind of need is out there for that one as well. So just to be a bright spot, hopefully to say that there's something available online to further education, because honestly, we're sitting on our seats for housing discrimination, wondering how this pandemic will lend to housing discrimination once we're allowed to leave the houses. You know, what is that going to mean? So we're sitting here on the forefront trying to make sure that we keep housing discrimination from happening across all our Arizona communities. And if I can be of any help, please let me know what I can do to be helpful.
Thank you very much. Phone number ending 8881. I'm going to unmute you now. And then Natalie, you're next. It looks like you unmuted yourself, 8881.
Hi, everyone. My name is Ashley Stockton. I'm from Guthrie Mainstream Services in Mesa, Arizona. I think what we're really looking for, we all have developmental homes as well as a group home and then multiple day treatment programs throughout the valley. I think I'm probably preaching to the choir right now, but what we're really needing right now is some guidance regarding quarantine guidance and PPE. Our developmental homes have members in the home, and one of our questions is if the member does come down with COVID-19, we don't have anything to provide to our homes at this time to protect them in caring for this member, including our group home. We have staff coming in and out of that group home daily. We have members that are severely immunocompromised, and there's no PPE to purchase. There's nothing that we can even get our hands on at this time. I know our staff is feeling a little bit fearful, and to be honest, we are as well. I think the other thing that we really would love DDD to address, and I know that they've got to work with other departments on this, is we need some sort of funding for our DTA and DTT programs due to the absences. Also, all of our administrative hours are non-billable hours, and we are still having to stay open. We do provide critical services that require administration to oversee, and we are not getting compensated for that. So those are our concerns and what we would really love DDD to be able to address.
I think DDD could be also a good stakeholder as an entity to put pressure on manufacturers to make more of those masks and protective equipment, because, and also maybe to open up some factories in Arizona. I mean, if we open factories of PPE equipment in Arizona, maybe employ some of those restaurant workers who got laid off, that might help to stunt the economic slump that we're getting ourselves into. What do you think, guys?
Thanks, Howard. I'm going to give Natalie a chance to speak. Who's had her hand raised?
Of course.
Hi, everyone. I just wanted to, I know, I believe it was Cathy who'd asked if we've received any calls here at the center. And we haven't received calls in terms of parents not being able to be with their adult children. We have received calls about there's so much misinformation out there. We received call one actually yesterday with a woman here in Tucson who called our office very scared that the rumor is that all people with disabilities, especially those in wheelchairs, were going to be evicted from their homes. And so that's what we're fighting right now, at least here at the center. I'm going to put in the group chat. We are updating every day on our website and our social media. We're also working on a fact versus fiction FAQ, hopefully that we can send to everybody. There's so much going on. I'm going to try to get that all done by hopefully the end of the week. But I'm going to put the information. If you know somebody, or you can message our center. I will put in our center email. You can also go through our website, which is azdisabilitylaw.org. I will again put that in the chat, and I know that will be in like the report after this. But I just wanted to let everybody know that I don't think, and I'm not going to speak on for my other colleagues, but I wouldn't be surprised if they haven't gotten calls, that they will be getting calls. And it's just information moving so quickly. But if you can really just try to hang on with us, and we'll do the best we can. Thank you.
Thank you. I see that Dr. Teresa has unmuted themselves. Do you want to share something?
Yes, can you hear me?
Yes.
So my big concern is I have a private day school for children that are placed in a level D placement for social, emotional, behavioral, and academic disabilities. My concern, having tried to push out programs for them to do at home, is we're dealing with the anxiety, the increased anxiety and fear and emotional unrest that's happening in the home, not just with them, but with their parents, who are also quarantined at home with them. They don't have the experience. They're not equipped to handle the behavioral symptoms or triggers that these kids are having. My concern is there seems to be nothing available for us to do, or if there is, what's out there that we could offer at least a reprieve for these parents, to give them some instruction on working with these kids, how to set up a home environment, but also how to help them with their emotional and anxiety issues that they're having that's kind of impacting these kids to a greater degree as well.
Thank you very much. Does anyone who joined solely on the phone interested in unmuting themselves and sharing? Someone who hasn't shared yet already, perhaps? Aron, I see you raised your hand again. Why don't you jump in, and then maybe someone from the phone will be ready by then.
Guys, Cathy, so sorry for not only what you're personally going through, but for the weight, the obvious weight that everybody has showing through you. Howard, that was a really great idea. I know not all of our families or people we work with in services are going to be able to go out and get those things. And unfortunately, as in education community, we're not allowed to drop things off. I had restored a bike, or I had a friend restore a bike for a student. I have an extra, iPad for a student that, would benefit from it. We're not allowed to give them back to them right now. But I did notice there's a save chat in the bottom right of the chat. There's a save the chat, which I think will let you keep it. So anybody who has, like Howard had the YouTube how to on even that little hot dog thing, but anything that could help all of us in that time. If everybody can just put their things in links, obviously carefully vet them. But in there, I believe we can all save the chat and refer to it and pass it to people who need it. Because I was like feverishly writing down all of these things, then I realized I could save the chat. So there you go.
Hi everyone, this is Sarah from ADDPC again. Thank you so much for all of your stories that you're sharing, what you're going through, your suggestions for others. There's been lots of activity in the chat box, and yes, Aron, you're right. We're going to share resources people have posted, both in a recap email, which will include a video recording, resources shared in the chat box, and then of course that legislative video that went out as well earlier this morning for people interested in the policy, the national policy updates regarding paid sick leave, regarding some of these other emergency measures coming out of Congress. So as I want to transition now to my colleague at the Sonoran, you said, Jeff, he is going to invite some of our policymakers to say a few words. Jeff?
Yeah, thanks, Sarah. So up first, we have State Senator Heather Carter, who will take the virtual floor.
Hi, everyone. This is State Senator Heather Carter, and I just appreciate you allowing me to join the call today. This has been obviously a time like none of us have ever faced before, and it's really important for us to come together as a community and figure out what we can do to address all of the unique challenges that the community is facing in caring for loved ones. I met some of you at the Capitol when we were still meeting face-to-face at the Capitol, probably about a month ago, and shared my story. I care for my elderly mom, so not necessarily in the same situation as the group on this call, but it's in many ways some of the same struggles that I have as a caregiver are the same struggles that you're facing. And it's really just about how do you manage your day-to-day life of making sure that they receive the medical care that they desperately need, making sure that you have the food and the resources available to care for them, and so forth. I thought I would take just a quick moment and let you know where we are at in the legislative process and provide you with some information that hopefully will at least let you know where we're at in the process. And by no means is this comprehensive and were we able to address every single solitary concern that we have. But the Arizona legislature on Monday finished their work on what's called a skinny budget. And what that means is the budget that we had in place for last year, we just reenacted it with a slight increase for inflation and population growth. And then there was an additional program put in place to address the COVID-19 situation. We put $50 million in a fund for the governor to use to address immediate needs around housing, food, and economic development things, such as keeping the doors open for small businesses and many of our providers here. I'm not sure how the governor will deploy those resources. They are what are called last dollar resources, meaning if there is money available for the federal government, that money would be expended before they expend this money. And now the Arizona legislature stands in recess until April 13th. That was a date that they put in place so that we will have some idea of what the state finances will look like. And just like many of our homes across Arizona, the state is experiencing an extreme financial downturn as well. Every metrics that we use to determine what our state economy will look like in the budget, but in the budgeting process is obviously showing great concern around decrease in revenue. We went into the session with almost $1 billion surplus with $1 billion in the rainy day fund. So, while we have available resources in the rainy day fund, I am fairly certain, based upon what we are hearing back from our financial committee, it's called a financial advisory committee, the FAT committee, is that the revenues will be severely cut immediately, and then we don't know how long that downturn will be. It's not great news, but it's news that I could imagine that we would all expect given this crisis that we're facing. I do want to also highlight that I worked relentlessly to get some sort of language in the budget around billable hours. I know somebody mentioned that you can't bill for administrative services, but even when we're talking about billable hours, providing direct services, and then those direct services are not being provided, you are unable to bill for services that you're not providing, and yet you still want to make sure you have a workforce in place as we continue to navigate this crisis that we face. So we put some flexible language in the budget that will allow you to bill for services that have been canceled, and that's specifically related to like Medicaid population and money through DES. So that's a work in progress. I do want to let you know, though, that we are standing at recess, so we did not sine die. And that's an important distinction, because if there is an emergency that we need to address, we can reconvene as a legislative body. Technology will be a little bit of a challenge because while we did allow for remote voting, I'm not sure if we are ready to scale up like we are here. However, we have 269 people on this Zoom call right now. Somehow we should be able to get 90 people together to be able to vocalize their vote. So I am pushing relentlessly for that, because there's no reason why we can't come together quickly and do anything we may need around that. I do want to make sure that you have available the governor's website around Arizona Together. I'm going to try and pull that up right now. And a lot of the resources that the governor is putting, arizonatogether.org. I'll try to type and talk, arizonatogether.org. I put that in the chat there. Also, if you want to send an email to the governor's office, you're able to do that through his website. You can send an email to me and I'll forward it to the governor's office. I'll put my email in the chat box here as well. Hold on, azleg.gov. And as things like this come up, that is something that immediately needs to be addressed or looked at, you can send them to me, you can send them to the governor's office. I am literally typing and texting while I'm on this Zoom call, dealing with a pharmacy issue around emergency prescriptions. So, for example, this is straight off the governor's text, where if you have a prescription that has expired and you're at that 12-month point, we're having difficulty people calling back in the renewal of the prescription, even if it's a prescription you've had for 20, 30 years. So the governor's office, this is hot off the press, is going to send a note out to all licensed pharmacists today saying that there is already statutory permission under ARS 32-1910, Section C, where they can refill those prescriptions. So things are moving so fast and furious. Please know that your elected officials are doing everything they can to make sure that you have the resources and the statutory provisions to be able to care for your loved ones. I'm happy to answer any questions. And as I said, if you want to send me a particular story or something that you'd like me to follow up on, my administrative assistant is working remotely. The entire staff is working remotely. So we'll do our best to follow up as we can.
Thank you, Senator Carter. We appreciate you being here and appreciate your words. I now have Tom Betlak, the Director of Department of Economic Security, who is on this call and is welcome to speak. Are there any technical difficulties?
If Tom's joining by phone and needs me to unmute him, I can, but I need to know which number is his.
While we sort this out, I just want to acknowledge staffers from our other congressional representatives, like Representative Ann Kirkpatrick, Representative David Schweikert, Representative Ruben Gallego, Representative Tom O'Halloran, and Representative Grijalva. So thank you to those staffers for coming and representing those offices.
If you're able to raise your hand, you'll go to the top of the list and we can unmute you. And that's on the bottom of the participant list.
I also just want to remind people that this is a weekly series and that we'll send out a registration link for next week's call by Friday. There will also be a recording and written recap of today's session via email, which will also include some of the answers to questions raised today. And again, if there are any follow-up questions after today's session, they can email Natalie at nlunarose, LUNAROSE, at azdisabilitylaw.org, or call 480-356-5195. Also, let's see if there are any lawmakers on this call who would like to speak. Please do. I see that Nancy Bardo, Representative Bardo is here. So yeah, if you just unmute yourself, you can take the floor.
Great, thank you so much. I really appreciate it. I've been listening in today and have been very touched by all that you all have been going through during this tough time. I don't want to repeat everything that my colleague just went through in great detail about what's happening at the legislature, but I do want to let you know that there are a lot of resources that are on their way, and through Arizona Together, there's just a ton of different categories to look through, from education to financial assistance to unemployment. And so I would just say, look at that website. If there's a specific issue, especially financially, that you haven't been able to get resolved in some way, to contact my office as well at nbarto@azledge.gov. And I'll try and do my best to find out where we can assist. I think what we've done at the legislature has been pretty groundbreaking in terms of making sure that there's flexibility in the type of reimbursements that our providers are allowed to get during this time, because obviously they can't bill for services that they don't deliver when people are not accessing those services. And then of course there are issues with not every individual is able to access the kind of services they need remotely. So we need to make sure that individuals are treated like individuals. And so I will do my best to reach out as a representative to the agencies and see how we can get even more flexibility in making sure that people get what they need. It really breaks my heart, Cathy Sweeney, that hospitals are treating families this way when their loved one is ill and in the hospital and not able to have that primary caregiver there by their side. I would really like that information sent to me so that we can follow up. This is, to me, it's unacceptable. I don't think anybody does this kind of thing on purpose, but often it takes a squeaky wheel to make changes. And so that's often why we're here, is to help you become that squeaky wheel. So again, I really appreciate it. I've been looking through the chats and writing a few notes, but I really do encourage you to reach out to one of us with your issue, so that we can be of assistance wherever your need may lie, and see if we can help. I know there's federal help on the way. They've been dithering a bit in getting it done, but you know, this is not a time for our most vulnerable to have even more at risk during a pandemic like this. So thank you. I appreciate, Sarah, you setting up the call, and whoever else was involved with that, and allowing us to be a part of the discussion today.
Thank you, Representative Bardo. We appreciate you being here. Thank you. Sarah, did you want to help close this out?
Sure, Jeff. Thank you so much. And thank you everyone for joining us today. I know that we are all in this together. I loved seeing the many resources shared in the chat box. Don't worry if it's hard to scroll through the many entries in there. We're going to send out a recap email. You'll find links that were shared today to different resources. You'll find a recording of today's Zoom call. You'll also find a link to the previous recording sent out this morning on the latest federal updates from Congress. Thank you to our local legislators for the local view. And we just hope to continue to be a resource. Our next Zoom call will take place next Wednesday. We hope to get some answers by then to a lot of the questions raised. And we also, in the future, plan on making this a weekly event. We're going to have themes. I know special education was a big theme today. We also heard a lot about in-home services. So if you have any suggestions for specific topics in the future, you know, we want to be a resource as the COVID-19 crisis plays out. And do not hesitate to reach out if you're facing a specific issue. We're a statewide council. The DD network is also statewide. We want to hear what's going on. Do not feel you're alone. Thank you so much. You can always, you know, provide feedback about today's call. We're all ears. We're all learning as well. So thank you so much for joining us. Take care, stay safe, stay healthy. Let's keep in touch. Thank you so much, everybody.
Thank you.
Thank you.
Thank you.
Thanks, everyone.
Thank you.
Thank you for joining us.
Thank you.
Thank you very much.
Thank you so much.
Everybody take care.
Thank you so much.
Thank you.
Sarah, I'm going to go ahead and end the meeting for everyone. And then I'll send out a link for all of us to meet and debrief. Thank you.
Thank you.
Thank you, John.